Good afternoon, everyone. For those that are joining us, good morning, good afternoon, and greetings from wherever you're joining us from. Welcome to this wonderful webinar series from the AfriChild Center, and we are so glad to have you here today. I can see our colleagues trickling in from all over the world. Thank you very much for joining us. We are going to be led by a team from Islamic University in Uganda who are going to be making a presentation. So we're going to give our colleagues at least 3 minutes. I can see we still have people joining us. So we'll give our participants at least 3 minutes to join us as we plan to start this wonderful webinar series. Please feel free to drop your organization name, your organization's name, and what you do there in the chat as we start to get to know each other, as we get acquainted to each other. And we are more than glad to have you here today. Please share with us your name, your organization, and where you're joining us from. And we will be glad to have you as we are waiting for our colleagues to join us. Our presenters and discussants are already on, and we are just waiting for our colleagues to join us, a few more colleagues to join us, and we'll start at exactly 5 minutes past 3 East African time. Professor Odama, I can see you in the chat from Uganda Matters University. Greetings from the AfriChild Center, and it's a pleasure to have you here today. I see Don Christabella, Probation and Social Welfare Officer from Amuru District. It's a pleasure to have you on this webinar series, and thank you for joining us. Professor Musa Matovu, also part of the study that's going to be presented here from the Islamic University in Uganda. We're also glad to have you here as well. I see Beatrice from Nakaseke. TTI, maybe could that be Teachers Training Institute? Please clarify, but we are also glad to have you. I see you in the chat. We are waiting for our colleagues in at least a minute or so that we can start. Okay, thank you very much once again for all of you that are joining us. I can see the comments in the chat. Agnes, Gender and Probation Officer, World Vision, thank you for joining us. Lydia, Lidi Umutabazi, thank you for joining us, advisor to the Deputy Vice Chancellor for Strategic Planning and Admin, University of Rwanda. Thank you as well for joining us. The team from Nakase Teacher Training Institute, Beatrice Akwang, thank you. Matia Kahwa Labe, thank you for joining us as well. Thank you all for joining us. And at this juncture, I would like us to start. My name is Clinton. I'll turn on my video. My name is Clinton Twena Tumanye, and I work with the AfriChild Center, where I lead communications. And for all of you that are joining us for the very first time, we are so glad to have you. And for those that have been with us for all the webinar series that we've had, not just this year, but for the previous years, it's always a pleasure to have people joining us for the very first time. And if there's anyone that's joining us for the first time who doesn't know about the AfriChild Center, we are a research institution based here in Uganda, but we do work across East Africa, but also across the continent. The AfriChild Center was established in 2013 through a collaborative initiative among 6 founding institutions. And among these were the Ministry of Gender, Labor and Social Development here in Uganda, UNICEF Uganda, Child Fund International Uganda, Makerere University, and TPO, along with Columbia University. And what these organizations identified was that a lot of work is being done, but there was a gap in terms of research to inform the policy and practice in regards to issues of children here in Africa. And the AfriChild Center exists to fill that gap. So we are purely a research organization, and we'll be sharing work from some of our research studies. Specifically for the presentation that's going to be made today, it's an output and an outcome from one of our flagship programs, and this is the Inter-University Child-Focused Research Methods and Training, Mentorship and Training Program, where we train mid and early career researchers who are faculty staff from different universities across Uganda, but also across Africa and East Africa, to conduct and carry out child-focused research. This webinar specifically, we will have a team from the Islamic University here in Uganda that are going to be making their wonderful research findings. And as part of the outputs from this training program, the AfriChild Center offers a seed grant to all of these institutions as a team. So the team from the Islamic University in Uganda was offered a seed grant to carry out the research that they will be presenting to us in this webinar. At this juncture, I would like to play a very short video that gives us a highlight of who we are as the AfriChild Center.
Where we strive for an Africa where children... Welcome to the AfriChild Center, where we strive for an Africa where children's well-being is realized for sustainable development. The AfriChild Center exists to generate research that informs policy and practice for the well-being of children.
Established in 2013, the AfriChild Center is focused on children, on the African child. Our vision is to see an Africa where child well-being is realized for sustainable development.
Yes.
Across the continent of Africa, and specifically sub-Saharan Africa, we continue to witness the plight of children across different spheres of life. Child poverty is on a high. Violence against children continues to plague the lives of children. We have very many children that are orphaned, child-headed households, a high school dropout rate with many children out of school or without the ability to access school and health services. Our institution, the AfriChild Center, has a regional outlook with the intention of generating evidence through research to help inform decisions that are made at policy level, but also at practice level, to help improve on the well-being of children. Our philosophy is hinged on the fact that if we want to see socio-economic transformation of Africa, it will happen through investment in children. As an organization, we have mapped out 3 core program areas that define the work that we do. One is research, and so we undertake child-focused research to inform policy and practice. 2 is we work to build the capacity of researchers, owing to the fact that we don't have enough researchers, especially child-focused researchers, generating evidence to inform the decisions that we make. But also building the capacity of the policymakers to be able to use evidence generated through research to inform the decisions and the policies they are formulating. If we are able to achieve the visions that we have, Vision 2030, it's imperative that we invest in the well-being of children.
Join us in our mission to transform the lives of children across Africa. Together, we can make a lasting impact. To learn more about the AfriChild Center and how you can support our work, visit our website or follow us.
Okay, welcome back from that very short but insightful video about the AfriChild Center. And I can see some people's hands already up, but we will have a Q&A session later on within the session where we'll invite those who have questions, those who might want to ask 1 or 2 questions after the presentation, but also after the discussion. But also we shall have a poll question where we'll invite you to share your insights within after hearing from the presenters. So at this juncture, I would like to just quickly run us through the agenda for today. Our presenters, like I had earlier mentioned, are from the Islamic University here in Uganda. And specifically, this work was done in the eastern part of Uganda, which is in Mbale, and they will be telling us more details in relation to that. We will have a presentation of bios, getting to know who our presenters are, where they are from, and details about their work. And we'll also have a poll question after their presentation. Thereafter, we'll have a discussion from one of the practitioners who is a leader and head of the remnant generation that does work around helping child mothers, victims of sexual violence, and they'll be telling us more of their experience. And then after that, we'll have a Q&A session. So if you have a question, please jot it down and have it ready. And you will direct it to either the presenters or the discussant at that very point. And at this juncture, I would like to introduce our presenters for the day. Just open. Okay. Okay, so we have Dr. Amina Hassan, and she's going to be the lead presenter for this exciting webinar. We are excited to hear from her. Dr. Amina is a senior lecturer in the Department of Foundations of Education at the Islamic University in Uganda. She holds a PhD in education from the International Islamic University in Malaysia, a Master's of Education Management and Foundations, and a Bachelor's of Arts with Education, both from Makerere University, MOOC, in Uganda. She has served as a Dean of Faculty of Education and Head of Department Foundations of Education at the Islamic University in Uganda. She's going to be our lead presenter for today. Our discussant for this wonderful webinar as well is Madame Annabelle Nakabiri Sebachije. She is the founder and executive director of the Remnant Generation, an organization that rescues and restores sexually abused pregnant teenage girls and victims of early marriage. She's a survivor of sexual assault and child marriage herself. Annabelle did not let her childhood misfortunes determine the rest of her life. She graduated with an honors Bachelor's of Science degree in accounting and finance from Chambogo University and acquired training in participatory planning, monitoring, and evaluation. Annabelle works very closely with the AfriChild Center as we have a lot of synergies, both in research but also in practice. You are welcome, our dear presenters and panelists who are going to be sharing with us your wonderful wisdom from the work that you have done. At this juncture, I would like to invite our first presenter, Dr. Amina Hassan from the Islamic University to present. Please share your screen.
Have I shared?
Not yet. We are waiting for your screen your presentation to share.
Okay.
Oh, I can see it coming up. Okay, please. Please put it in full screen and proceed with your presentation.
Okay. Ladies and gentlemen, protocol observed. Good afternoon, good morning to you all, wherever you are. This is our presentation, a study of child mothers' experiences on community-based rehabilitation in Mbale district, located in Eastern Uganda.
Okay, doctor, could you kindly put it in full screen? There's a button just down there below. Presentation mode, just before 76, right there. Thank you very much. Please proceed.
Yes, the study was carried out by a team from Islamic University in Uganda, a 4-member team. Yes, the problem is child motherhood. And this is substantiated by the statistics, as we can see. Worldwide, 11% of all births are to girls aged 15 to 19, and 95% of this occur in low and middle income countries. Uganda in particular is not an exception, and according to the statistics in Eastern Uganda particularly, approximately 30% of these girls get pregnant at that early age. When we come to Mbale district, in particular, between 2021 and 2024, they registered 8,819 childbirth. That is according to the Mbale District Health Office. Then I zeroed down to the 5 sub-counties which were considered in this study. The 5 sub-counties registered 2,166 child mothers. Yes, these child mothers face several challenges. Among the challenges are poor health conditions, complications during pregnancy and childbirth, stress, anxiety, depression, low self-esteem, social stigma, and many more. Studies have been done which found out these challenges. Yes, so because these child mothers face several challenges, they need support. So the objective of this study was to highlight the experiences of Mbale community-based rehabilitation services to these young mothers, because they face challenges we think that they really need support. So we'd like to find out, do they really receive support from their communities or from Mbale district community? The specific objective or specific objectives include to assess the psychosocial support received by child mothers in Mbale district. 2, to assess the health support received by child mothers in Mbale district. And 3, to assess financial and livelihood related support received by child mothers in Mbale district. The study was guided by the following research questions. What types of psychosocial support were received by child mothers in Mbale district? 2, what types of health support were received by child mothers in Mbale district? 3, what types of financial and livelihood related support were received by child mothers in Mbale district? Methodology, the approach and design, we used the mixed method approach, and convergent parallel mixed method approach was carried out. We collected quantitative data and supported by qualitative data. Site, population, sample, and sampling techniques. We find that the study was carried out in Mbale district, particularly in 5 sub-counties, which are Bufumbo, Bumbobi, Bungoho, Busiyu, and Nyondo. The population was child mothers and their parents or caretakers. Quantitative data was collected through stratified sampling, and we had 106 child mothers who participated in the quantitative study, those who filled the questionnaires. And then qualitative data and we selected 10 child mothers who were interviewed, and 10 parents or guardians were also selected for focus group discussion. All these participants were identified by community leaders. We had women leaders in the 5 sub-counties, and also youth leaders in the 5 sub-counties. Data analysis. The quantitative data was analyzed through simple statistics, whereby we had the frequencies, percentages, mean, and standard deviation. And then the qualitative data was analyzed through thematic analysis. Findings of the study. The demographic data revealed that we looked at the education level of the participants. 62% revealed that they only attained education up to primary level. Then 37.7% revealed that they attained education up to secondary level. They were asked about their marital status. They revealed that 54.7% were single, 40.5% revealed that they were married, 2.8% revealed that they were widow, and 1.9% cohabiting. When asked about employment, 84.9% revealed that they had no work or they were not employed, and 10.4% revealed that they were carrying out some trade. And then others was 4.7%. That was demographic information. Findings continued. Objective 1 was looking at the psychosocial support received. The findings revealed that the parents cared for these child mothers. They were counseled by parents, by community members, by religious leaders. They also revealed that they received the peer support. Peer here, they were their friends, colleagues whom they studied with, not the other peer that the child mothers. No, their friends and those colleagues they studied with. Then they also received the counseling from NGOs. Some of them revealed that their babies were fed by NGO, and then they also received some support from the father of the child. So as we can see, the mean is low, and on average, they received moderate psychosocial support. Then the psychosocial support was also supported by findings from the interviews. One of the child mothers revealed that my mother supported me by providing food, clothes, some money, and my father supported me occasionally. Then guidance and counseling from the focus group discussion. One parent said she was emotionally challenged, referring to the child mother, and wanted to throw away the baby. I counseled her, if I had thrown you away, where would you be now? Religious leaders also, one of the child mothers said, my mother counseled me, and prayer partners like pastors come and pray for me. I get their telephone number and call them whenever I feel low in spirit. By attending meetings like church meetings, sometimes they advise us, like girls, to be strong and to work hard. Financial support, her mother supported her. She was in a saving group and she got the money to support the daughter. That was one parent who revealed that. Yeah, we move on. Findings continued. We look at the healthy support. That was objective 2. They received several support from the health sector. Counseling was offered to them, health care, access to birth control, education about balanced diet, education about feeding, immunization of their children, and many others. So as we can see from the means are high, and this reveals that these child mothers at least received high support from the health sector. Findings from qualitative interviews and focus group discussion. One of them revealed that we receive health care like antenatal, treatment, referral, immunization, and so on. Another one revealed that I was taken back to the health center and I was admitted and I was treated and the wounds healed. About education on balanced diet, one of the focus group parents revealed also healthcare like advising them on what to feed the babies on and treatment issues. On guidance and counseling, those nurses and doctors could arrange so that to give advice to us. So these are these child mothers. They talk about many things, telling us if you have anything which is hurting you or what is making you stressed, just come here, we give you some advice. So those are qualitative findings supporting the quantitative findings. Findings on objective 3, that is financial support. We also asked them whether they received some kind of financial support. They revealed that they got some financial support from NGO, and then some revealed that they are doing some kind of work to generate income for themselves. Some revealed that they attended a financial literacy workshop in the community. Others revealed that they received PDM money. These were only 4, so we can see that it was really very minimal. And others revealed that they belonged to a financial circle in the community. So when we look at the mean, we can see that they are really very low, and it shows that these child mothers received low financial support. Findings from the interviews and focus group discussion to back up the quantitative findings. One of them revealed that I got support from ITEC. It is an NGO. They paid for scan, blood test, transport, etc. So we can see that these people received this support mainly from the hospitals, main hospital where they were referred to. Then income generating, one of them revealed that my mother gave me some small money to start a business. Another one revealed that my mother helped me with some money. It was 50K, that I do something so that I can take care of my child. And another one revealed my mother looked for the money to pay the facility after delivering, and we were discharged. Yes, so summary of the findings. Objective 1, we summarized that there was moderate psychosocial support from Mbale district community to the child mothers. The support came from family members, community members, NGOs, and community organizations. The support came in form of care, guidance, counseling, protection, assurance, empathy, etc. They also received instrumental support, for example, food, shelter, clothing, medicine, and other necessities. Objective 2, the findings or the study revealed that there was high health support to the child mothers. For example, antenatal care, treatment, referral, education on breastfeeding, immunization of babies, counseling, etc. And objective 3, there was very low financial support given to the child mothers. NGOs, PDM, and they also received financial literacy. Conclusion. The study concluded that these child mothers received support from their communities, and the high support came from health sector and the family, while minimal support came from the community members and NGOs. Although they received support, it requires improvement. It was not all the best. Implication for practice. The findings provide important insights as potential community-based support to the wider population of child mothers in Mbale district. Community leaders should create awareness among stakeholders about the child mothers' support so that they can help these young mothers to improve their lives. It is not the end of the world to give birth at that early stage. They should be given another chance to move on. Child mothers should register with NIRA and acquire national identification to enable them access government services like skilling hubs, PDM funds. Yeah, as we have seen that there was really low financial support. So these child mothers need to get the skills to empower them and also to get the funds to empower them do more, maybe business and the like. NGOs to extend their services to rural settings to access more vulnerable communities. Yeah, the study found out that the NGOs supported them from where they were referred to, like in hospital, main hospital. So if they can move to rural settings and they support the child mothers from there, it would help them in better their lives. That is the end of our presentation. We thank AfriChild for the support, and I thank you everybody for listening to the presentation. Back to you, moderator.
Thank you very much, Doctor, for your very wonderful insights and for your wonderful presentation. And I am sure our participants and our audience have got questions lined up for your presentation. Before we get to the poll question, I can see a hand that has been up from the start. So please, Judy, before we get into the poll question, could you maybe, if it's burning, could you ask the question? You can kindly unmute yourself and ask the question. Okay, perhaps maybe you could ask the question when we get to the Q&A session. Okay, so you will see on your screen there's going to be a pop-up of a poll question. Doctor, you might want to stop sharing your screen. Yes,
Okay.
wonderful. Thank you. A poll question is going to appear on your screen. It's going to take about 3 minutes. Kindly respond, and thereafter we'll be hearing from our discussant, and then we'll be taking your questions right after.
The biggest gap is financial and livelihood support because they receive very low support in that area.
Thank you, Doctor. So if you could also kindly respond to the poll. This question is to everyone, and they are responding to the poll question. So if you can also respond to the poll question on your screen by choosing one of the questions. So we have 2 poll questions. One is on the gap, and the other one is on the support. So the first question is on, and I can see questions coming up. Most of our responses are saying financial and livelihood support is the biggest gap. I can see 11% of our participants are saying that psychosocial support is the biggest gap. I'll be showing the results after that. So that's poll question 1.
Actually, it's not.
Okay. And our poll question 2 is up. The poll question is, which type of support do child mothers in your location, in your setting, what is the support that they receive the most?
Health support, but I cannot. I'm clicking, but not health support.
What type of support do child mothers in your setting receive the most? Please feel free to respond to any of the suggested responses. I can see a good number is saying that the most support that children receive is psychosocial support. Child mothers receive is psychosocial support. I can see now the largest percentage of our responses is saying that health support seems to be the most kind of support that child mothers receive in their setting. And of course, this definitely varies from setting to setting. So it could be psychosocial support for the urban setting. It could be health support. It could be financial support in humanitarian settings. And definitely these responses can vary. So thank you very much to those that have taken time to respond to our poll question. And if you can see the results on your screen. So our results for poll question 2, saying that the largest support that child mothers receive in their setting, which is 55% of our participants today, are saying that it is health support. Okay, thank you very much. And once again, I can see our colleagues whose hands are up. I'm going to ask that you kindly pack the questions. And for those that would want to leave them in the chat, please feel free to leave them in the chat. But we'll also have a Q&A session where we'll open up your microphones and allow you to ask those questions directly to our presenters. At this juncture, I would like to invite Miss Annabel Nakabiri-Sebachije, who is the Executive Director of the Remnant Generation, TRG, to share with us based on her experience working in the space, but we're also working with child mothers, with victims of sexual violence. And later, we want to invite her to hear from her based on the findings that have been shared, but also from the experience from her work. So Annabelle, you're welcome. And please unmute yourself and feel free to turn on your video and share with us your thoughts. Thank you. Annabelle, you're welcome. Kindly unmute yourself and okay. I guess our presenter is getting a few challenges, but she's just back on. Annabelle, you're welcome once again. Kindly unmute yourself and please feel free to speak to us.
Thank you so much, Clinton. Hello, everyone. It's so good to be here. Thank you so much, Dr. Amina, for that amazing presentation and the team that you worked with on this research. Again, my name is Annabelle Nakabiri, and I am the founder and executive director of the Remnant Generation. As rightfully introduced, the Remnant Generation serves young mamas and that are survivors of sexual violence as well, and child marriage. I myself, coming from that very same background, I am always very encouraged when I see more people getting involved, researching, studying, and discussing how we can give young mothers and young girls, especially, an opportunity to thrive after what has happened to them. And one day we hope that we do not have to have these conversations, because no child needs to be a mother when they are just still a child. They need to be protected and given an opportunity to grow as children. My quick comments, I know that there are some specific questions that I have to be responding to, but I want to just, first of all, celebrate IU for the study that you have shared. And there are some really intriguing results that I wanted to comment on. One is that we are doing so well. I want to celebrate our healthcare system. At some point, we were really advocating and pushing for healthcare services because young mothers were afraid of going to hospital, and when they would go, they would be really stigmatized and they would struggle to get services. But to see that 84.9% of the girls were able to access healthcare support, that is really, really commendable. And looking at the staggering numbers of girls receiving financial help, it is not a surprise, but it's also a statistic that is affirming things that we have found in our work over the last 10 years that we've been involved as the Remnant Generation. These are children. Chances are high that one, they are not ready to engage in gainful employment because of their age. Two, they have dropped out of school at a young age, so chances are high that they are not being employed because they don't have experience, they don't have training that is expected or required in workplaces. And three, it is also possible that, especially given the context of this research, which is in Bali, and looking at the culture, history as well, and with the Embalu practices and the practice for a long time that looks when girls have gotten pregnant, many of the moral policing that comes from with culture and religion is to get those girls married off, and rightfully so. I wasn't surprised when I saw that 40.5% of these girls were reported as married, and we even had widows, 2.8%, and 1.9 that were cohabiting, meaning that those that were recorded as married were actually, there was some formalization of that arrangement. Either there was bride price that was exchanged, either there was a negotiation between parents of the girl and the man or the boy in the picture. So that is what was called married. And then cohabiting maybe is the situation where there isn't a kind of like a legalized settlement. Hajat, I could possibly maybe speak into some definitions of how they defined married and cohabiting and all of that, but from my personal external view, that is what I was picking from the findings. And it is also revealing that we have a lot of work to do. We didn't get the age brackets of the girls that were interviewed. I know that generally there was a general statistic on the ages of girls in the eastern region that become child mothers, and they were really generally looking at 15 to 19 years old. At our work in the remnant generation, we've had girls as young as 11. The youngest mother we've had in the shelter is 11 years old, who was 11 and pregnant. So we don't know what the ages were, but chances are high that these girls were younger. Maybe Hajat will clarify when she comes on. So as we look at these results and the interventions that have been provided with healthcare, you see that we are keeping mothers and babies alive, which is fantastic, but we are not equipping them to thrive. The girls are surviving the labor ward, the babies are alive, and we thank God for that, but we are not doing enough in Mbale to equip these girls to thrive. Government has a program now that allows that actually passed a policy that allows child mothers to go back to school. And I realize that while we are looking at financial support, which is in key, and I'll be happy to share what the Remnant Generation is doing in helping young mothers to gain economic stability. But we also need to not forget that these are children, and many of them are not really at the stage where they are able to work and they need to go back to class. So a lot of work is evidently seen that needs to be done to encourage parents to create awareness with parents to take girls back to school and to understand that it's not the end of the road, because now the policy allows for them to go back to school. Girls can go and achieve their academic dreams. As we look at such strategies for economic independence, given the low financial support that was shared as an issue in Mbale, the remnant generation, what we do, some of the things that we do in our interventions, we are able to get these girls to learn skills that help them to create business clubs within communities. We have center-based care and also community-based care. And at community-based care, our focus is to see that we get these girls into peer spaces where they are together with other young mothers, coming together to learn a skill. They are usually united through connection with the VHTs at the health centers, and they are able to create community clubs. And within those community clubs, we are able to provide counseling. We are able to engage them into skills training that don't require a lot of investment and a lot of time for them to learn. They are learning liquid soap. They are learning pad making. They are learning how to process groundnuts. They are learning how to basically even do childcare so that they can support one another in taking care of children and then getting paid as a team. So they come up with their creative ideas. We also have clubs that are doing in the Antonde district, for example, where we have over 580 girls in the Yakajula sub-county that are organized in 13 safe spaces. And they are able to, they're running piggery projects, poultry projects, goat rearing, And these girls, from those savings and working together, they are now able to support each other to go back to school, and buying just basic things, because most of them are going to government aided schools. But of course, there is some bit of payment that is needed and some requirements that are needed. So they are able to generate that income together. So Mbale district, there is that opportunity for us to see how can we get girls to organize into peer groups within communities that help them to access financial opportunities. We are also looking at childcare, having baby-friendly skilling spaces. One of the biggest limitations for girls that are young mothers to go back to school and also to engage meaningfully in economic activity is the failure to have childcare. Even for older women, many of them have to quit jobs because they don't have someone to take care of their baby after they have given birth. How much more a young girl? So, but if we are able to get these girls into support groups, we have seen it working, that they are able to identify among themselves one who is able to stay with the baby, with the children, after they have breastfed, and they need to be able to go to work, or they need to be able to get to deliver service products to the market, and then the other person is taking care of the babies. So that definitely works. We still see that it is important to engage the fathers and the men that are responsible for these children as well. If, as we think community care, as we think support, sustainable support for young mothers, many of them are ending up into marriage, and the man, for lack of a better word, is looked at as the source of security, economic security. And I know that the study didn't cover the men, but it is very interesting for us it is important for us as practitioners to interest ourselves in seeing how do we get the fathers of these children to be involved in providing care, and also finding solutions, sustainable solutions for the girls as well. Yes, it's one thing to say, let us take them to prison and all of that, but there is a child in question, and there are also families that are settling for negotiation and child marriage, which is wrong. We need to be able to change that. But how do we get families of these young men and themselves to see that they take financial responsibility as well and support the young mothers? So I will stop there for now. Those were my quick reflections from the presentation. Over to you, Clinton.
Thank you very much, Annabelle, for those very wonderful insights. It's always a pleasure to hear from the remnant generation and the amazing work that you're doing, especially around skilling girls and getting to have them acquainted with their peers, so that they don't feel lonely. They don't feel that the world is at an end because something happened to them. So it's amazing that you share with us those findings, but also to hear that girls as young as 13 have come to your shelter when they are when they are when they are already pregnant. And this is a call to action, not just to civil society organization, but also to government to step up and support entities like yourselves that are doing some of this work. As we get into the phase of the questions, I know we have some questions lined up. I can see already some in the chat. I'll kick off with some questions to our presenters, and allow me begin with you, Annabelle. Based on your work, how can community-based rehabilitation programs be redesigned to ensure balanced support across health, psychosocial, and economic needs for child mothers in similar settings? Could you elaborate more in what could be what community-based rehabilitation programs can be redesigned to ensure balanced support across health, psychosocial, and economic needs for child mothers in similar settings? It could just be Mbale, it could be Buyukwe, it could be Western Uganda. Are there specific thoughts that you could share with us?
Yeah. Thank you, Clinton. I think we cannot neglect the fact that this is going to require a multi-sectoral approach. We need to be able at community level to create synergies between actors in the child protection sector, health sector, get people from the private sector as well that are providing opportunities and jobs, and come together and plan and tailor solutions for every community, because several communities are different. When you go to a pastoralist community, interventions there will be a little bit unique to that than it is to urban centers, and maybe than it will be to places like Mbale. But if we need to be able to come together and realize that this is not a problem that one person can solve or one entity can deal with. It's going to require a multi-sectoral approach. That is number one. Number two, it is also going to require that we engage the girls, not to think that they do not have an idea of what can work for them, but to engage them and say what can work for them, so that we do whatever we do with them involved at the center, not to come and sit at and plan strategies at district level or at NGO level and then take perceived solutions to the community, but getting the girls on board to see what do they want and how can they get involved. Get the girls to lead. We have seen that working. Building their agency to know that these are not just, yes, they have experienced abuse, yes, they are child mothers, but they are not without brains. They have a capacity, and so building their agency will also help a lot. It goes far in preventing secondary pregnancy, if that is the right word to use, repeated pregnancy. When you build girls' agency to lead solutions, to be able to reach out to other girls, I think most of the interventions fail when we go and think that we are just helping the girls, instead of empowering the girls to be part of the solution to their problem. And and then the other thing was to engage the men and boys as well, who are in the first place the fathers of these children, and who are also, to deconstruct whatever cultural beliefs or religious beliefs or just societal norms that have given them a mindset that thinks, they are entitled, or to having these girls as early as they want, and they don't care. Some of them don't know, some others it's been like prolonged cultural belief systems and practices, and engaging men to see what happens. We've seen us get ourselves getting young fathers and also older men, taking them to actually understand what a girl goes through when she's pregnant, and what she goes through in the labor ward, and what happens if she has gone through a C-section. That awareness flips their mind. If abuse has happened, if you sexually abuse a girl, what do you do to them? And also, what do you do? What happens to you? That having those honest conversations with men and engaging them at community level will go a long way in one, preventing it from continuing to happen, and two, getting them to own up to their actions and taking responsibility. And so that way we reduce because many communities think that marrying off the girl is going to solve the problem, but it doesn't. It just continues to make the problem worse, because then young mothers are the highest candidates of gender-based violence in most of the communities. So
Thank you very much, Annabelle, for this.
engagement.
Yeah, thank you very much for these very wonderful insights. Multi-sectoral approach. Let's empower the girls to be able to know that we are not just helping them, but we're empowering them to avoid secondary pregnancies, but also engage the boys slash the men. Let them know the implications of what's happening. It shouldn't be cultures and norms passed down, but we need to engage the boys to also understand the consequences of having our young girls pregnant. Thank you very much, Annabelle, for those wonderful insights and thoughts. I would like now to just ask one more question to Dr. Amina before we open it up to everyone. Dr. Amina, from your wonderful presentation and the research that you did in Mbali, from your findings, given the low financial and livelihood support found in the study that you did in Mbali, are there any specific interventions that should be prioritized to improve economic outcomes for child mothers that you found in your study?
Thank you, moderator. Yes, the intervention I would think about is taking these girls back to school so that they can get skills, knowledge, which can empower them to be economically independent. As we noted that there are government hubs which are in the community. So these girls can go and have these skills, which can enable them to do something and earn a living. So I think that is what is the intervention I can think of immediately. They need to get the skills, and also those who can to go back to school and study. It can improve their lives.
Okay, thank you very much, Dr. Amina, for sharing that and for responding to that question. I'm now going to go to the chat and read your comments, your questions, and I'll start with Miss Judy Kamani, who says that there is also a government policy that allows child mothers to continue with their primary, secondary education. I believe that we are referring to the recently launched ECC policy. And yes, thank you very much for sharing that with us, Judy. I'll also read Sheikh Bamba's comment. It may be important to develop resilience and a program to combat household poverty. I believe colleagues who are in this webinar from different civil society organizations might respond to different interventions that are being implemented, not just in Uganda, but across Africa, that are trying to combat. And of course, like Annabelle mentioned, this should be a multi-sectoral approach. You cannot achieve this only as non-government organizations. We need to work with other agencies, whether it is government, whether it is civil society, whether it is police, law enforcement. We need to approach this as a multi-sectoral approach to be able to combat issues of child marriage and child pregnancy. I'll also read Jeannie Bowman's comment. In the study, I believe this could be a question. In the study, which parts of the community in Mbale were the child mothers from, for example? Were they mostly long-term residents or internal migrant communities? Were they identified from within informal settlements in Mbale, or what kind of communities? This question is directed to Team IUIU, and we'll have you could jot these questions down. I believe it's not just Dr. Amina that is here representing the team, but it's also Professor Musa Matovu, who was also part of the study. You will respond to this question from Jeannie Bowman later on as we read the comments. Just scrolling through. Another comment from Judy: revised guidelines for the prevention and management of teenage pregnancy in school. I believe she is referring to the guideline that allows girls to be able to go back to school once they've been pregnant. Thank you very much, Judy, for that clarification. Just proceeding, who really will receive the highest grade of causes of child marriage, taking into consideration living in changing society today? This is a question to Dr. Amina. I'll read it again. Who really will receive the highest grade of the cause of child marriage, taking into consideration living in changing society today? That's a question from Vuzara Godfrey, and it is to Dr. Amina. Another question from Miss Judy Kamani. What about investing more in adolescent sexual reproductive health services and birth control? And this is an open question, so please, Annabelle or the team IUIU, feel free to respond to that question. I would like to pause from there for now, and we first respond to these questions briefly as we get more questions in the chat. Thank you, and I will start with team IUIU.
Okay, thank you, moderator. The questions, one of them, what kind of communities these child mothers come from? As we mentioned that the study was carried out in Mbale district, and we chose 5 sub-counties from Mbale district. So the participants came from the villages in the sub-counties. So they came from the what? From Bale, not any other area. We had several villages where they came from these 5 sub-counties. Then another question was on who is the cause of this child motherhood. We cannot say that one particular person is responsible for this. I think there are several causes of this child motherhood. One, you can say poor parenting is one of the causes because parents have not done well their role of looking after these child mothers. They end up getting pregnant and give birth to poverty in the society. There's a lot of poverty in the society, and because of this, the young girls are enticed by those people who can give them some little money, and in the end, they end up getting pregnant and give birth. Then culture also, we know in Mbale district, when it is season for Kadodi, you find that they move from one place to another. There's no control over these girls, and in the end, they get pregnant. So I can say that there are several causes for this child motherhood. Then the discussant asked about the age of these child mothers. The youngest among our respondents was 14 years, and the majority of them were 16 years at the time of giving their first birth. And then education. What was the other question?
The question, which was open, was from Miss Judy Kamanyi, and she was asking, what about investing more in adolescent sexual and reproductive health services, like birth control? So among your recommendations, could this be a recommendation, or is that something that you also looked into while conducting your study?
Okay, in our findings, we saw that when these people were going for this health care and the like, they were educated about contraceptives, and also they were accessing that service from the health center. Maybe the recommendation can be that as a preventive measure, we can sensitize the girls in schools about that healthy and sexual reproductive approach.
Okay, thank you very much for those responses. Annabelle, do you want to chip in and respond to any of the questions that were asked, that you want to make an addition?
Yes,
Okay.
thank you so much,
Okay, please.
Clinton. I just wanted to quickly add to the question about can you hear me? Did I
Yes,
drop off?
Yes.
Yeah.
Okay.
Yes.
Yeah, and to the question about contraception and teaching girls sexual reproductive health. And I know that usually whenever we have conversations around teenage pregnancy, there is always a temptation for us to think that the easier solution is just getting all the girls up maybe 13 years and above, or even now 9 years and above, onto contraceptives. And whereas that can give us a temporary relief, it doesn't eliminate the fact that there is child abuse going on. I want us to note that with concern that every teenage pregnancy is a direct indicator that there has been childhood sexual violence. And contraception does not take that away. And we know that the damages that come as with general childhood sexual violence and the effects, including teenage pregnancy, are heavy, equally heavy. That psychological, that trauma, and all of that goes in. So I want to submit that it is important for us to intentionally consider teaching, moving from just teaching children about sex or just telling them to swallow a pill, to equipping girls and boys as well to understand their identity, and to give education on body autonomy, for them to know who they are, what is happening to them as the body changes, and sorry, someone was saying something.
I think I should mute. Sorry.
Okay.
Please proceed,
Yeah.
Annabelle.
Yeah, equipping girls and boys to understand body autonomy. We need to be able to reconsider our approach to solutions, to focus as well on child protection, and getting the girls to understand that it is not, and boys to understand it is sexual violence, and that is what we need to be dealing with. And so no one should touch your body when you are still a child, and then teaching them the body autonomy, to know that they have a right to stop this from happening. They can say no, they can report, they can seek help. And also for the men and boys to understand that they cannot touch a child, and to that the boundaries and respect. When we do not push for the that awareness of self-control, the awareness of child protection, the awareness of childhood sexual violence, no matter how many pills that we give our children, it will not solve the problem. So I just wanted to make that additional submission on top of all the other interventions that we need to be able to as well lean into that. Thank you.
Okay, thank you very much, Annabelle, for those wonderful insights. I can see more comments coming in from the chat, and uh, Modest from Inter University also works with the AfriChild Center closely, and we are glad to have you on this webinar today. And you're saying, Dear Dr. Amina and the team from IUIU, congratulations for this intriguing and interesting study. And his question, do the child mothers access professional counselors for their psychosocial needs? If so, may you elaborate on that? This is Dr. Odama Kai Modest asking. So we'll take at least a few more questions and then we'll respond to them at once. Thank you, Claire, for that clarification on the guidelines. Another comment and question from Hope Tashinga Magaya. Hope is asking, what are the modes that we can use to engage parents and guardians to accept that these young people, these children need to be enlightened about sexual education openly and directly, not shying away from the responsibility due to cultural norms that may not allow us to talk about sexual reproduction health with children. Thank you very much, Hope, for that comment. And I believe Dr. Amina responded to this, but also Annabelle in her presentation mentioned that cultural norms and practices, as witnessed in Mbale, Eastern Uganda, are some of the leading causes to issues of teenage pregnancy, child mothers, and these pregnancies that we've seen in the presentation. Another comment from Bamba, he's saying holistic approach, intersectoral, multisectoral approach, yes, as mentioned by Annabelle. Musana Bashir says meaningful participation for young mothers at all sectors and hands-on activities are key to development. Thank you very much, Musana, for that comment. Lidi Umtabazi is saying that, did you also include young mothers with disabilities among the respondents? If yes, which categories of disabilities were most represented? So those are two questions to Dr. Amina. Could you kindly and briefly respond to them as we are nearing to the close of our webinar?
Okay, thank you, moderator. Yeah, I start with that of the counselors. Do these people receive professional counseling? The findings reveal that these people receive counseling, but the counseling came from various groups, one religious leaders, then elderly women in the community, Then the from the health what? From the health what? From health sector. So from the findings, there's nothing pointing to professional what? Counselors. There's nothing pointing to professional counselors. I think it is the kind of a voluntary people who guide them, giving them advice here and there.
Okay, thank you very much, Doctor, for that clarification. And I believe that that is an area of improvement where we can work with government to have parasocial workers, to have people in the community, not just those who are doing this voluntary, but even those that are doing this work voluntary. We can find ways to support them to be able to provide this very crucial service to our girls in the communities. The other question was from
The
Lydie,
question
and
was
she was,
about disability.
yes, from, yeah.
The study had only one child mother who was she got disabled during giving birth, whereby she paralyzed. The whole lower limb was paralyzed. But actually, before that, before giving birth, she was normal. So we didn't have people who were disabled in the study.
Thank you very much, Doctor, for that clarification. And of course, this study, after going through the necessary requirements, will be published, and these findings will be made available to the entire public. And in case you might want to access the findings directly, please feel free to reach out to us as the Africa Center, and we'll be happy to work with the team at IU to make the findings available for you. I can see one hand raised. From Joan. Joan, kindly unmute yourself and please direct your question to any of our presenters. Joan, you're welcome. As Joan is looking for the unmute button, I'm going to just take the question from Mr. Shafiq Sekalala, who is asking, what support have the child mothers received from local government and other leaders? From your findings, Dr. Amina and the team IU, did you find that there was any support from local government and other leaders in the communities?
Thank you very much, Sir Shafiq, for that question. Yeah, the findings revealed that these child mothers received the health service support from the health centers. And these health centers are put there by the government. Health Center 2, Health Center 3, and then 4. So from that, I conclude that the government has helped in one way or the other to support these child mothers, since they pay the health workers, they buy medicine and so on, and so many other things in these health facilities. And secondly, also they mentioned about the counselors in their community who are there to give them advice and the like. So in that way, the local leaders are also involved in supporting these these child mothers. Yeah, that's what I can say about that.
Okay, doctor, thank you very much for that.
Also the hubs, whereby they skill these people, the hairdressing, the what, so they can access these facilities and get these skills. All this is done by the by the government. They have these hubs in their communities. I think they mentioned about 2 of the hubs, which give skilling to everybody, the young mothers, the youth, and whoever is interested.
Okay, thank you, doctor, for that clarification and for that wonderful response. Joanne, are you able to now unmute yourself and ask your question? Your hand has been up for a while. Kindly unmute yourself. Okay, I think Joanne is finding a hard time, so we are nearing the end of our webinar, and I'm just going to ask our presenters, starting with Annabelle, in just within 2 minutes, could you just briefly share with us your parting shot? What do you think should be the recommendations, and based on your experience, where is the largest gap and what should be done? Annabelle, just I'll ask the question just one more time as we near the end of our webinar. We would like to hear from you what your parting shots are. Are there any specific recommendations? What do you believe should be done to make the situation of our girls better? But also, how can we make it safer for our young girls? Are there any specific stakeholders? Is there something specific that government should do? What are your specific recommendations to make it safer for our young girls
Yeah.
in just under 2 minutes?
Thank you so much, Clinton. And it was such a pleasure me being part of this. One, I believe that we need to reframe our conversation around the issue of child motherhood and realize that it's a child protection gap and address it as so, and make sure that we are consistently promoting child protection and safeguarding measures at all levels, from family to schools to communities to churches to mosques, and make sure that everyone is on board with that. Secondly, we need to realize that many young mothers are invisible, and to just break that off them and realize that they are children that need opportunity and protection, and they also have capacity and gifting. So getting them on board to find solutions goes a long way in changing this narrative. We have seen it work for over 11,000 young girls that we have served within the last 10 years. We know that it is possible for young mothers to lead their own transformation of their own stories and to break the cycles of repeated pregnancy and also block child marriage from happening when you give girls a chance. And finally, it's a multi-sectoral approach. We are going to need everyone to play their part. And if we do that, we are going to rewrite the story. It is possible for us to have a Uganda that is free from sexual violence against children, and to give those that have already succumbed to the circumstance, fallen victim to the circumstances, give them a chance to thrive again. Thank you so much.
Thank you very much, Annabelle, for the wonderful parting shots and for sharing us with your wisdom. It's very very touching working with teenage girls, and of course, from your experience, you shared with us that there's a lot of work that needs to be done to better the situation of our young girls. Over to you, Dr. Amina, from the work that you've done both in this study but also in your other experiences. Are there any things that you recommend that should stand out, not just for civil society or government, but even academia? Is there any specific suggestion? Because at the AfriChild Center, we found that what is the leading drive of our work is that there's limited research on issues of children. So things like prioritization and budgeting by government entities for child protection is a big priority. So from your experience, Dr. Amina, are there any suggestions, any things that we need to prioritize, not just for government and civil society, but even other stakeholders to better the situation of our young girls in Uganda and the whole of Africa?
Yeah, thank you very much, moderator. Yeah, I will not repeat what my colleague has already said. So maybe I can come in from the academic point of view. I recommend that institutions should engage in more research on children and child mother and girl child in particular, to ensure that we bring to light more about these girls, so that we can have solutions. The more we learn, the more we highlight about them, the more people will find solutions to help these girls out of the challenges they are facing. And in addition, we should not only look at girls, but also the boys, as the discussant pointed out, that these boys also need to come on board, because they are the ones who are one of the causes of this child motherhood. So if we study more about them and find solutions on how to help them, I think this challenge of motherhood may be reduced. And we should sensitize these girls also to continue with education, whether through getting skills or furthering their education to higher levels. This is not the end of the world. If they gave birth, they can still achieve more and more through education. Yeah, I would like to end there. Thank you very much, moderator.
Okay. Thank you very much, Dr. Amina. Thank you very much, Annabelle. Are there any colleagues from IU that might also want to chip in and say one or two things as we end our webinar? And yes,
thank you very much, moderator and members online. First of all, on our behalf, I would like to thank Dr. Amina, who has done a very good job on bringing forward. Whatever she has brought forward is what the group brought up or came up with in the study. My key aspects, which I would like to emphasize, is the bottom line of two aspects which Annabelle brought on board, that we do not help, we empower. Actually, in most of our findings and what we discovered in the field, everybody's calling for help for these child mothers. Please, can you help? Please, can you do this? And so on. But picking it from Annabelle, it is quite important that these girls are just empowered and not helped. And this, I think, would be a big difference. Secondly, is bringing the boy child on board. And the issue which is outside there, everybody's talking about the girl child, the girl child, the girl child. And no one talks about the boy child. Maybe they're not recognized, or they don't recognize the big factor they play into making these young girls pregnant. I think it might not be realized, but again, from the discussions that have been put forward, I think the boy child must be put into the struggle to see that the child motherhood can be solved outside in the communities there. So thank you very much, moderator, for this opportunity today.
Thank you very much, Prof, for those very wonderful insights. What an amazing way to summarize the findings, but also the discussions from both the main presenter and from our discussant. And to everyone that has taken time to be with us this afternoon, this morning, this evening, depending on where you're joining us from, it's been a pleasure having you, and for me, a pleasure hosting you here on the AfriChild Center webinar series. We always host these on the last Tuesday of every single month, and it's always a pleasure to have you in numbers turn up to be able to listen to our very diverse audiences and presenters. And for those who spare time to ask the questions, we find it very, very, very amazing, because you help us expand the learning, and also we hope that you feel free to join us for our next episode of our wonderful webinar series. This webinar was slated to end at 4:30 East African time, and it's exactly 4:30 East African time. So thank you very much. Good morning, good evening, and good afternoon from where you're joining us from. Have a wonderful day. Thank you for joining us today.
Thank you.